So we'll start. Bravery, chivalry, efficacy, virtue, duty, legendary. Our firefighters. When the alarms go off in Minnesota's fire stations, we half expect Rudolph Valentino or The Rock or John Wayne or Wonder Woman to show up and save the day by performing Herculean tasks. And yet when these people behind us show up, they're real human beings. We don't ask them who's under that helmet or who's behind that mask. They just show up for us when we're in crisis, after explosions and fires and crashes and acts of violence and accidents. We're often too busy grieving or frightened or simply hanging on to ask for their names. These heroes and heroines are not superheroes. They're just like you and me. They get cancer, they suffer from trauma, and they get heart disease. The only difference is they get it at higher rates than you and I. There's a firefighter memorial about 3 blocks from here, straight that way. Sometime today, perhaps, go look at it. Get some inspiration. And look at the number on that helmet of that firefighter, because the number 10 is on that helmet. And to me, it's a metaphor for how high these people stand in my esteem. Minnesota firefighters are ready at any moment to answer any call, putting their lives on the line for us. They deserve our respect and our gratitude. But they also deserve the support they need to deal with the dangers they face at levels that we can only somewhat try to understand. They respond when we call, and now we need to respond when they call. We are here today to hear from those that would benefit from the Hometown Heroes Assistance Program. These are our hometown heroes.
Hello, I'm Representative Cheryl Joachim. I represent Hopkins and St. Louis Park. And this bill really has grown organically out of the departments across the state. And when my 2 fire chiefs came forward, I couldn't say no because it's way too important. I would like to thank the folks at MnFire for keeping the health and safety of our firefighters in the spotlight and for bringing forward this initiative. You will hear the stories today about the high incidence among our firefighters of cancer, cardiac issues, and mental health challenges they face just to be able to do the jobs we ask them to do. And we ask them to do a job that many of us would never be able to do or willing to do. They do this job without hesitation, and we need to have their backs. In House File 1782, the Hometown Heroes Act, it's a basic step we can do to do just that, to have their backs. It includes funding for statewide critical care policy for all Minnesota firefighters, which would cover diagnosis of cancer or cardiac issues. It includes an employee assistance program targeting emotional trauma issues unique to the fire service. It provides ongoing annual awareness training for our firefighters on cancer, emotional trauma, and cardiac care, as well as awareness training for our medical and mental health professionals. I'm proud to help lead this charge in the House alongside of Senator Swedinski in the Senate as we begin this journey. And I'm very happy to report that the bill has bipartisan support. And now I would like to turn it over to George Ebsen from the Minnesota MnFire Initiative.
Thank you, Representative Joachim and Senator Swedinski. My name is George Esbenson. I'm the president of the Minnesota Firefighter Initiative, and I would just like to say that we really appreciate the support that our legislators are giving to us. The bipartisan support is outstanding. And one fact that I think everybody should understand is that compared to other states in the nation, Minnesota ranks 21st in population. Unfortunately, we rank 45th in our support of the Minnesota Fire Service, so we're 5th from the bottom. And this bill will go a little ways towards changing that funding paradigm and giving support to our brave heroes, the women and men who serve in the fire service, against the ravages of cancer, cardiac, and emotional trauma. Thank you again.
Hi, my name is Dennis Edwards. I've been a firefighter for 28 years. I'm the son of a firefighter, and I am now the fire chief in Duluth. In those years, I've seen way too many of my friends, my colleagues, and my family suffer to cardiac disease, cancer, and mental health trauma. And we need to stop that. And the Minnesota Fire Service, we're doing the best we can to change the outcome of the 3 leading killers of firefighters, but we need help. So I'm asking that since in Minnesota, if you call, a team of firefighters will come and deliver. So what we need is elected officials to deliver for those firefighters. We need help. Thank you.
My name is Chris Parsons. I'm president of Minnesota Professional Firefighters. I'm a St. Paul fire captain of 18 years. And when I was a kid, the Army had a recruiting tool, video commercial, where the motto was, "This is the toughest job you'll ever love." Well, I drive in every single day thinking that I have the greatest job in the world, and I'm sure that my brothers and sisters here behind me will agree that this is the greatest job that we could ever hope to have. However, there is a downside to that. There's a downside to this rewarding career, and that is mental health issues that a lot of us face, the addiction issues that a lot of us face, the cancer and cardiac risks that a lot of us are facing. And it's we're stepping forward as fire service leaders to take care of our problem. That's what great fire service leaders do. They see a problem and they take care of it. But we do need some help from the state of Minnesota and from local governments in tackling these issues. And so that's why we're here today. We're hoping that this bill will move forward this year and that we can put our priorities in line with our checkbook and take care of the people that are taking care of the citizens of this state. Thank you.
I think we're available for any questions folks might have.
The press release says it's a bipartisan bill. What's your support on the other side of the aisle?
We're working on it. But the Department of Public Safety has no concerns with the bill, so I think we're good.
And we just introduced the bill about 2 or 3 weeks ago, and I've already had a lot of members jump on board, both Republicans and Democrats, because folks realize the importance of making sure that we take care of our first responders.
I've got one more.
Yeah.
You
would have been great to have in class.
Some firefighters are volunteers, some it's paid positions. How does this bill factor in with those who maybe already have health care versus those who don't? Are there firefighters who actually don't have any health care at all?
Yes, thank you for the question. So in Minnesota, about 7% of the firefighters are career firefighters, and the other 93% are non-career, meaning volunteer, paid on call, duty crew, but they don't do it for their full-time job. What this legislation seeks to do is provide critical care insurance. So if there is a diagnosis of cancer or cardiac issues by a doctor, then there's supplemental money that comes to you to help offset costs that would not be covered by health care. But this is not replacing health care, it's a supplemental strategy. And then as far as it goes for emotional trauma, every firefighter in the state would have access to 5 employee assistance sessions with people that are specially trained to deal with the trauma that firefighters face, which is different than what the general population experiences when they need EAP assistance. And then for anyone that needs more than 5, there's another pool of money that's funded by this bill that would provide additional EAP assistance. And then on top of that, there's ongoing awareness training every single year, because we know that a lot of these things are driven by our culture of not saying things, not stepping up. We step up to help others, or they do, but often neglect their own well-being, and so we need to change that paradigm. And then last but not least is establishing regional centers of excellence, so that no firefighter in Minnesota has to drive more than an hour and a half to get high-quality care no matter where you are in Minnesota.
And excuse me, yes, George, when this bill gets passed, we will go from 45th to
44th and a half. So we'll make a Herculean jump by half a spot. I mean, that just shows the magnitude of the issue. It would take 15 million a year to go to 45th and 100 million more a year to get to 40th.
So you're saying other states invest a lot more money in the mental and physical welfare of their firefighters?
Yes, ma'am. 45 other states invest more heavily than we do.
Thank you, one and all. And
Thank you
thank
very
you, all of you behind me.
Thank you. Thank you very much.